Have you ever wondered what happens to the mind after a traumatic event? Let's delve into the world of post-traumatic stress disorder, or PTSD. It's a mental health condition that can affect anyone who has experienced a significant traumatic event. This might involve witnessing or experiencing something that threatened their life or safety, or that of others around them, leading to feelings of intense fear, horror, or helplessness. PTSD is not just about having bad memories, it's far more intrusive and can affect a person's everyday life. Imagine reliving a horrifying incident over and over, experiencing nightmares that jolt you awake, or feeling a constant state of tension as if danger is always around the corner. Now, how do we diagnose PTSD? This is where the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, or DSM-IV-TR comes into play. It's an essential tool used by mental health professionals to diagnose mental conditions, and it has a specific set of criteria for PTSD. According to DSM-IV-TR, a person with PTSD has been exposed to a traumatic event in which they experienced, witnessed, or were confronted with an event that involved actual or threatened death or serious injury. Their response involved intense fear, helplessness, or horror. The traumatic event is persistently re-experienced in ways that can include recurrent and intrusive distressing recollections of the event, recurrent distressing dreams, or acting or feeling as if the traumatic event were recurring. Furthermore, they persistently avoid stimuli associated with the trauma and show signs of numbing of general responsiveness. This avoidance can manifest in various ways, like efforts to avoid thoughts, feelings, or conversations associated with the trauma, efforts to avoid activities, places, or people that arouse recollections of the trauma, or an inability to recall an important aspect of the trauma. Understanding PTSD is the first step towards empathizing with its sufferers and finding ways to aid their recovery. Scene script. Let's dissect the DSM-IV-TR diagnostic criteria for PTSD to understand how professionals identify this disorder. To begin, an individual must have been exposed to a traumatic event where they experienced, witnessed, or were confronted with circumstances involving actual or threatened death, serious injury, or a threat to personal integrity. This exposure often elicits intense fear, helplessness, or horror. In children, this might manifest as disorganized or agitated behavior. After exposure to the traumatic event, the individual persistently re-experiences it. This can take different forms, such as recurrent and intrusive distressing recollections, including images, thoughts, or perceptions. In children, this could translate into repetitive play, where themes or aspects of the trauma are expressed. Recurrent distressing dreams about the event are also common. For some, it might even feel as if the traumatic event is recurring, leading to intense psychological distress and even physiological reactivity when exposed to cues that symbolize or resemble aspects of the traumatic event. Furthermore, there is a persistent avoidance of stimuli associated with the trauma and a numbing of general responsiveness. This is indicated by efforts to avoid thoughts, feelings, conversations, activities, places, or people that arouse recollections of the traumatic event. Some individuals may even be unable to recall an important aspect of the trauma. This avoidance often leads to a markedly diminished interest or participation in significant activities, feelings of detachment or estrangement from others, restricted range of affect, and a sense of a foreshortened future. Finally, the symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, and they must persist for more than a month. It's important to remember that these criteria are not a strict formula. Each person's experience with PTSD is unique. Symptoms can vary in intensity over time, and not everyone will experience every symptom. The DSM-IV-TR criteria are not just a checklist, but a guide to understanding the complex nature of PTSD. Acute stress disorder may sound similar to PTSD, but they are not the same. Let's clear up the confusion. Acute stress disorder, or ASD, is a response to a traumatic event just like PTSD. The symptoms are also similar: re-experiencing the event, avoiding reminders of the trauma, and heightened arousal. However, ASD symptoms occur within 4 weeks of the traumatic event and last anywhere from 2 days to 4 weeks. Conversely, PTSD symptoms persist for more than a month and may not appear until months or even years after the incident. Another critical distinction is that ASD can be a precursor to PTSD. If the symptoms of ASD are not addressed promptly and effectively, it may evolve into PTSD, a more chronic and debilitating condition. Knowing the difference between acute stress disorder and PTSD can help in early detection and treatment. PTSD is not just about flashbacks and nightmares, it impacts every aspect of a person's life. Let's delve into the far-reaching effects of post-traumatic stress disorder. This condition doesn't only affect the mind, it reverberates through every facet of life, from relationships and work to physical health and personal well-being. Imagine a life where one's own mind feels like a battlefield. That's the reality for those with PTSD. Their mental health struggles can strain relationships with family, friends, and partners. They might find themselves withdrawing from social activities or experiencing difficulty in maintaining close relationships. This isolation can further fuel feelings of loneliness and despair. The effects of PTSD also permeate the professional sphere. Work can become a Herculean task as concentration dwindles and productivity suffers. This can lead to job loss, financial instability, and the stressors that accompany these challenges. Physical health is another area where PTSD leaves its mark. Studies have shown that individuals with PTSD are more likely to experience physical health issues such as heart disease, chronic pain, and sleep disorders. These physical ailments not only impact quality of life, but they can also complicate the path to recovery. And let's not forget the personal well-being of those grappling with this condition. Everyday activities that once brought joy may now feel overwhelming or uninteresting. This loss of interest in activities can lead to a decreased quality of life and contribute to feelings of hopelessness. It's imperative to note, however, that PTSD is not a life sentence. With understanding, support, and treatment, individuals can reclaim their lives. Various therapies, medications, and self-care strategies can help manage symptoms and promote recovery. The statistics and studies are clear. PTSD is a serious condition that can impact every aspect of a person's life. But it's equally important to remember the resilience of the human spirit. With the right tools, support, and determination, those living with PTSD can navigate their way towards a healthier future. PTSD is a serious condition, but with understanding, support, and treatment, individuals can reclaim their lives. Before we wrap up, we have a small request. If you found this video helpful and want to stay informed about the latest in health and medicine, don't hesitate, hit the subscribe button now and join our community. Please, give this video a thumbs up to encourage us to bring you more insightful, comprehensive, and high-quality videos on a wide range of health topics. Our channel, Medicine Health 360, is dedicated to delivering crucial, up-to-date, and systematic medical and health knowledge in a straightforward and digestible format. Our goal is to empower everyone with the knowledge they need for better health and a better life. Your support allows us to continue doing what we love, creating informative and engaging content for you, so don't forget to hit that subscribe button and join us on this journey towards a healthier future. Thank you for your support.